So what is the best medication for heavy periods in women? Well, this depends on what you're looking for. If you're looking for hormonal or non-hormonal options, if you want something quick acting, or if you want something to last you for a longer duration, depending on how long your heavy periods are meant to last. So for instance, we've got a medication called norethiesterone. Norethiesterone is a hormonal medication that contains a high dose progesterone. It is quite effective for stopping heavy periods. Usually you take 3 days before the start of your period, and that is because it takes about 3 days for this to work. Norethiesterone is very effective, usually stops your flow within about 2 to 3 days, and it is something that you can take for 10 days, but we don't normally advise not to take it for more than 30 days as a long-term medication, simply because you do have side effects such as the high risk of blood clots. Because norethiesterone, though it is a high dose progesterone, also contains some estrogen hormones, so it does have a thrombotic effect on the body. So if you're not keen on a hormonal option such as norethiesterone, you can consider tranexaminc acid, which is non-hormonal. And tranexaminc acid, again, we normally advise that if you do have a family history of blood clots, not to take tranexaminc acid. Now, tranexaminc acid is more of a prostaglandin, so basically is a fibrinolytic agent, which means that it helps the blood clots to form. Unlike norethiesterone, you don't have to take tranexaminc acids 2 to 3 days. However, it is not as effective in the sense that it might not completely stop your blood flow. It might reduce the amount of blood flow, but to not completely stop the blood flow. Tranexaminc acid doesn't have estrogen, so you can take it for long periods. However, we do normally advise to take it only during your periods. So, you take it day 1 of your period, you take 500 milligrams 3 times a day, and if your period is 7 days, then you stop on day 7, or if your period is 10 days, then you stop on day 10. Now, other more long-acting options include your contraceptive pills. There are different types of contraceptive pills. You've got your microgynon, you've got your Listerine, Femodet. These are all combined oral contraceptive pills. You've also got the mini pill. The mini pill is something that you would take if you cannot take the combined contraceptive pill for any reason, such as, again, is there a family history of blood clots? Have you had a personal history of blood clots? Or is your BMI over 35? Are you a smoker? Are you someone that has a high risk of having blood clots? So therefore, the mini pill will be the best option, and mini pill could be Cerazette or Cerel. These are all examples of the mini pill. And unlike the combined contraceptive pill, you don't need to have a 7-day break where you have your periods. You can take this back to back and continuously. So these are contraceptive pill methods that you can use for heavy periods. But the best treatment, or the treatment that doctors tend to favor the most, is the Mirena coil. Now, the Mirena coil is very, very effective in stopping heavy periods. Usually works about 72 hours of putting the coil in, and you don't have to worry about taking a pill or a tablet every day. The coil is put in, you just leave it there and can stay there for at least 5 years. You don't have to worry or think about it. However, it is very important that you know what the cause of your heavy periods is. For example, if you have fibroids, you might not be someone that can take the Mirena coil, especially if the fibroids are greater than 3 centimeters. Then Mirena coil is a contraindication, simply because the Mirena coil might not work and you might fall pregnant. And that is because the coil simply cannot stay in the endometrium, which is the womb, because the fibroids are most likely to push the coil out. However, if you're not keen on taking any of these methods, whether it's tablets or the coil, then really we need to find what the underlying cause of your heavy periods are. So you might need blood tests, check your blood clotting, check your thyroid, because thyroid also controls your periods, check your full blood counts to see if you're anemic. Also have a pelvic ultrasound, as I mentioned, to look for causes like fibroids. Check the thickening of your womb, because very thickened lining of the womb can also cause heavy periods as well. And depending on what the findings show, you might need further investigations such as a hysteroscopy, which is a camera that looks at the lining of the womb, which might then progress to you having a laparoscopy, because some women with a condition called endometriosis can also have heavy periods, and they also tend to have painful periods as well. In many cases, you do not ever find a cause for your heavy periods. You've had all the investigations and there's no cause for your heavy periods. And this is known as DUB, dysfunctional uterine bleeding. And in this scenario, it's basically treatments to control the symptoms rather than to treat the underlying cause. So I hope you enjoyed this video. Please feel free to like, share and subscribe.